So today's top tips are around the patellofemoral joint and BMI. So this paper that's recently come out by Landsmeer et al. Really highlights the importance of considering the BMI, the body mass index, for the patellofemoral joint. We know that the worldwide trend is one of increasing BMI and that there are many health and economic burdens of this. However, just for now, for this 3-minute top tips, I want to consider this with respect to the patellofemoral joint. So I really like this paper. It was a substantial study that gave us some really interesting insights. So 666 knees from women in their 50s and 60s with mild osteoarthritis of the knee at baseline were MRI'd and then once again MRI'd at 2.5 years. And quite simply, they grouped the knees into patients who'd had weight gain, weight loss, or stable weight. And look at these results. The odds for progression of bone marrow lesions and cartilage defects in the patellofemoral joint increased by 62% in the weight gain group versus the stable weight group. Yes, 62%. And then furthermore, the progression of synovitis was increased by more than 2.5 times in the weight gain subgroup compared to the stable weight subgroup. We know that synovitis is very much part of the inflammatory component of OA, the component that brings about pain, effusion, and can often really be cited as a deterioration in the patient's experience living with their osteoarthritic knee. And in my experience, that fits with the fact that you often get wiry people with terrible looking x-rays, but actually they aren't in a lot of pain, they don't have an effusion, and they're functioning just fine. And then you often get people who are overweight, whose radiographic changes may be milder, but they come in with a warm, effused knee and they're really struggling. And then this final point is interesting. The changes in cartilage and bone marrow lesions was greater in the patellofemoral joint compared to the tibiofemoral joint. So it would seem that the patellofemoral joint is particularly sensitive to changes in BMI. So it's not just about the load coming down through the knee with someone that's heavier. It also seems to be that the pathway, including the inflammatory pathway, is faster, more aggressive in those people who are heavier. So it can be a difficult conversation, can't it? But we mustn't shy away from it because the emerging literature is so convincing about the importance of BMI. So tell the patients, look, if you lose weight, you have a double win. You lose load on the knee, but furthermore, the inflammatory state may reduce. And the flip side of that is to gain weight when you have an osteoarthritic knee would seem to be putting you at risk of accelerating that osteoarthritic pathway. If you'd like more top tips or more information for yourself or your patients on the patellofemoral joint, please look at www.clairepatella.com.